I'm 96 years old, and I've spent 72 years as a cardiologist. I've seen over 14,000 heart attacks in my career. And I need to tell you something that's going to make you angry. Almost every single one of them could have been prevented. My name is Dr. Samuel Hartmann, and I'm standing here today because I'm furious. Furious that people are still dying from heart attacks when we've known for decades exactly how to stop them. Furious that the medical system keeps treating symptoms instead of causes. And furious that most of you watching this right now are walking around with a ticking time bomb in your chest, and you don't even know it. Let me tell you about a patient I saw 3 weeks ago. Her name was Margaret, 74 years old. Came into the emergency room at 2 in the morning, clutching her chest. Massive heart attack. We saved her life, but she lost 40% of her heart muscle. 40%. Gone forever. Replaced with scar tissue that will never pump blood again. You know what made me angry? I pulled her medical records. 5 years ago, her cholesterol was high. Her blood pressure was elevated. Her doctor told her to watch her diet and exercise more. She didn't. 2 years ago, same thing. 1 year ago, same thing. Every single warning sign was there. Every single opportunity to prevent what happened. And nobody did anything. Margaret will never walk up a flight of stairs without getting winded again. She'll never play with her grandchildren without needing to sit down. She'll spend the rest of her life on 6 different medications, managing the damage that never had to happen. And the worst part, she's not unusual. She's typical. I've been a cardiologist since 1952, 72 years. I've watched medicine make incredible advances. We can replace heart valves. We can put stents in blocked arteries. We can transplant entire hearts. We can do things that would have seemed like science fiction when I started, but you know what we still can't do? We can't undo a heart attack. Once that muscle dies, it's gone. And despite all our fancy technology and expensive procedures, the best treatment for a heart attack is still the same thing it was in 1952. Don't have one in the first place. That's what I'm here to tell you today, because after 72 years of watching people destroy their hearts with completely preventable risk factors, I'm done being polite about it. I'm done watching people nod and smile in my office and then go home and do exactly nothing to save their own lives. Let me start by telling you how I got here. Because I didn't always understand this. I learned it the hard way. I became a cardiologist in 1952 at age 24. Fresh out of medical school, full of knowledge about the heart and how it works. But I didn't understand disease prevention. Nobody did back then. We thought heart attacks were just something that happened to people as they got older. Bad luck, genetics, nothing you could do about it. I watched my own father die of a heart attack when I was 31 years old. He was 58, dropped dead in his office on a Tuesday afternoon. No warning, just gone. And I was a cardiologist and I couldn't save him because I didn't see it coming. After he died, I pulled his medical records. I went through everything and I found it. All the warning signs. High blood pressure for 10 years, high cholesterol, overweight, sedentary, smoked a pack a day for 30 years. Every single risk factor was documented, every single one. And nobody, including me, did anything about it. Because we didn't know, we didn't understand that heart disease is cumulative, that it builds up over decades, that by the time you have symptoms, the damage is already catastrophic. That's when I changed everything about how I practice medicine. I stopped waiting for heart attacks to happen and started trying to prevent them. And over the next 70 years, I learned exactly what works and what doesn't. And here's what I learned. 90% of heart attacks are caused by 9 risk factors. 9, not mysterious genetics, not bad luck. 9 measurable, modifiable risk factors that you can control. Let me tell you what they are. Because if you understand these 9 things and you do something about them, your chance of having a heart attack drops by 90%. 90%. The first risk factor, and this is the most important one, is smoking. Nothing destroys your heart faster than cigarettes. Nothing. I've watched smokers have heart attacks at 45, 50, 55. Massive attacks that kill them or leave them disabled for life. And every single time, they tell me the same thing. I was going to quit next year. Next year never comes. Here's what smoking does to your heart. Every cigarette you smoke damages the lining of your arteries. That damage causes inflammation. That inflammation causes cholesterol to stick to your artery walls. That buildup hardens into plaque. That plaque blocks blood flow to your heart. And when blood flow stops, your heart muscle dies. It's not complicated. It's not mysterious. It's direct cause and effect. And it happens whether you smoke 5 cigarettes a day or 50. I had a patient 20 years ago, 52-year-old man, came to see me for chest pain. I did an angiogram. All 3 of his major coronary arteries were 90% blocked, 90%. He was one bad day away from a massive heart attack. I told him he needed to quit smoking immediately. He said he would. 6 months later, he was back in my office, still smoking. I begged him to quit. He said he was cutting back. 3 months after that, he had a massive heart attack. We did emergency surgery, quadruple bypass. He survived but lost 30% of his heart muscle. You know what he told me when he woke up? I should have quit when you told me to. Yes, you should have. If you smoke, quit. Today. Not next week, not next month. Today. Because every day you continue smoking is a day you're actively destroying your heart. And unlike other organs, your heart can't regenerate. Once it's damaged, it stays damaged. The second risk factor is high blood pressure. This one is a silent killer because you can't feel it. You can walk around for years with blood pressure of 160/100 and feel completely fine. No symptoms, no warning, until the day your heart explodes. High blood pressure damages your arteries the same way smoking does. Constant high pressure causes the arterial walls to stiffen and crack. Cholesterol seeps into those cracks. Plaque builds up, arteries narrow, blood flow decreases, and eventually completely stops. I had a patient 15 years ago, 68-year-old woman, came for a routine checkup. Blood pressure was 170/110. I prescribed medication. She didn't want to take it. She said she felt fine. Why take medication when she felt fine? 2 years later, she had a stroke, left side completely paralyzed, can't walk, can't feed herself, can't speak clearly, all because she didn't want to take a pill. Here's what most people don't understand about blood pressure. The damage is cumulative. Every day your blood pressure is elevated is a day you're damaging your arteries. And that damage doesn't reverse when you finally get it under control. It's permanent. Your blood pressure should be below 120/80. If it's higher than that, you need to do something about it. Diet, exercise, medication. I don't care what it takes. Get it down and keep it down. The third risk factor is high cholesterol. And this is where the medical system has completely failed you. Because doctors have been telling you for decades that cholesterol is the enemy and you need to get it as low as possible. That's not entirely true. Your body needs cholesterol. It's essential for building cell membranes and making hormones. The problem isn't cholesterol itself. The problem is when you have too much of the wrong kind of cholesterol in your blood and not enough of the right kind. LDL cholesterol is the bad kind. This is the cholesterol that sticks to your artery walls and builds up into plaque. If your LDL is above 70, you're at increased risk. If it's above 100, you're in serious danger. HDL cholesterol is the good kind. This is the cholesterol that actually pulls the bad cholesterol off your artery walls and carries it back to your liver to be eliminated. You want this number to be as high as possible. Above 60 for men, above 75 for women. And then there are triglycerides. These are fat molecules in your blood that increase inflammation and make it easier for plaque to form. You want this number below 150, ideally below 100. I've had patients with total cholesterol of 200 who had perfectly clean arteries because their HDL was high and their LDL was low. And I've had patients with total cholesterol of 180 who needed bypass surgery because all their cholesterol was LDL and their triglycerides were through the roof. The numbers matter, the ratios matter, and if your doctor is just looking at total cholesterol and saying you're fine, get a new doctor. The fourth risk factor is diabetes. This one is particularly devastating because it accelerates every other risk factor. If you have diabetes, your risk of heart attack is 2 to 4 times higher than someone without diabetes. And if you have diabetes and you smoke, you're basically playing Russian roulette with your heart. Here's why diabetes is so dangerous. High blood sugar is like sandpaper in your arteries. It scrapes and damages the arterial walls constantly. That damage causes inflammation. That inflammation attracts cholesterol. And diabetics typically have terrible cholesterol profiles. High LDL, low HDL, high triglycerides, the perfect storm for heart disease. I've had diabetic patients in their 40s with arteries that look like they belong to 80-year-olds, completely calcified, narrowed, blocked, all from years of uncontrolled blood sugar eating away at their cardiovascular system. If you're diabetic, your A1C needs to be below 7, ideally below 6.5, and you need to be monitoring your blood sugar daily, not weekly, daily. Because every day your blood sugar is elevated is a day you're destroying your heart. The fifth risk factor is obesity, specifically belly fat. And I need to be very clear about this because the body positivity movement has convinced a lot of people that you can be healthy at any size. You can't. Being significantly overweight, especially carrying excess fat around your abdomen, increases your risk of heart attack by 50 to 100%. Why? Because belly fat isn't just sitting there doing nothing. It's metabolically active tissue that pumps out inflammatory chemicals 24 hours a day. Those chemicals damage your arteries, raise your blood pressure, increase your cholesterol, and make you insulin resistant. I've done thousands of angiograms over my career, and I can tell you without question that the patients with the most severe coronary artery disease are almost always significantly overweight. Not always, but almost always. Your BMI should be below 25. Your waist circumference should be below 40 inches for men and below 35 inches for women. If you're above those numbers, you need to lose weight, not for vanity, for survival. The sixth risk factor is physical inactivity. Your heart is a muscle, and like every other muscle in your body, if you don't use it, it gets weak. A sedentary lifestyle increases your heart attack risk by 30 to 50%, even if all your other numbers are perfect. Exercise does 3 critical things for your heart. First, it strengthens the heart muscle itself so it can pump more efficiently. Second, it improves the health of your arterial walls, making them more flexible and less prone to damage. Third, it improves your cholesterol profile, raising HDL and lowering triglycerides. You need at least 150 minutes of moderate exercise per week. That's 30 minutes a day, 5 days a week. Walking counts, swimming counts, cycling counts, anything that gets your heart rate up and keeps it there. I'm 96 years old, and I still walk 5 miles every single day. Rain or shine, I've done it for 40 years, and my arteries are cleaner than most 50-year-olds I see in my practice. The seventh risk factor is poor diet. And I'm not talking about calories, I'm talking about what you're actually putting in your body. The standard American diet is literally designed to give you heart disease. High in saturated fat, high in trans fat, high in refined carbohydrates, high in sodium, low in fiber, low in nutrients. Every meal you eat is either fighting disease or feeding it. You're either building up your arteries or breaking them down. There's no neutral. You need to eat vegetables, lots of them, at least 5 servings a day. You need to eat fruits, whole grains, beans, nuts, fish, lean poultry, healthy fats like olive oil and avocados, and you need to stop eating processed food. If it comes in a box or a bag and has an ingredient list longer than 5 items, it's probably destroying your heart. Processed meats, fried foods, sugary drinks, baked goods, all of it. I've had patients completely reverse their heart disease with diet alone. Plaque that was blocking 70% of their arteries reduced to 30% just from eating differently for 2 years. It works, but only if you actually do it. The 8th risk factor is excessive alcohol consumption. Notice I said excessive. Moderate alcohol consumption, 1 drink per day for women and 2 for men, might actually have some protective effects for your heart. But more than that, you're doing damage. Heavy drinking raises blood pressure, increases triglycerides, causes irregular heart rhythms, and weakens the heart muscle itself, leading to a condition called cardiomyopathy, where your heart just can't pump effectively anymore. I've had patients in their 50s with hearts so weak from alcohol abuse that they needed transplants. Hearts that should have lasted another 40 years completely destroyed in 20. If you drink, keep it moderate. If you can't keep it moderate, stop completely. The 9th and final major risk factor is chronic stress. This one is harder to measure, but just as deadly as the others. Chronic stress raises your blood pressure, increases inflammation, raises your blood sugar, and triggers behaviors like overeating, smoking, and drinking that further damage your heart. Your body wasn't designed to be in fight or flight mode constantly. When you're stressed, your body releases cortisol and adrenaline. These hormones are supposed to help you escape immediate danger. But when they're elevated all the time, they destroy your cardiovascular system. I've had patients with perfect cholesterol, perfect blood pressure, healthy weight, regular exercise, and they still had heart attacks because they were so chronically stressed that their bodies were constantly bathed in inflammatory stress hormones. You need to find ways to manage stress. Exercise, meditation, yoga, time with family, hobbies, therapy, whatever works for you, because unmanaged stress will kill you just as surely as cigarettes. Now here's the part that's going to make you angry. All 9 of these risk factors are modifiable, completely within your control. You can quit smoking, you can lower your blood pressure, you can improve your cholesterol, you can control your diabetes, you can lose weight, you can exercise, you can eat better, you can drink less, you can manage stress. And if you do those things, your risk of heart attack drops by 90%. 90%, let me say that again, 90% of heart attacks are preventable if you control these 9 risk factors. So why is heart disease still the #1 killer in America? Why am I still seeing emergency rooms full of heart attack victims every single day? Because people don't do it. They know what they should do, but they don't do it. They say they'll quit smoking next year. They say they'll start exercising when they're less busy. They say they'll eat better after the holidays. They say they'll deal with their stress when work calms down. And then they have a heart attack at 55 and spend the rest of their shortened lives wishing they'd started earlier. I've had this conversation thousands of times over 72 years. And I can tell within 5 minutes whether someone is going to take my advice or ignore it. The ones who ignore it always have the same excuses. I don't have time to exercise. I can't afford healthy food. I've tried to quit smoking, but it's too hard. I'm too stressed to worry about my health right now. And you know what I tell them? You don't have time not to exercise. You can't afford not to eat healthy food. Quitting smoking is hard, but dying is harder. And if you're too stressed to worry about your health, you're going to be dead, and then stress won't matter anymore. Harsh? Yes, but I'm 96 years old, and I've earned the right to be harsh. Because I've watched too many people die from completely preventable causes to be gentle about it anymore. Let me tell you what actually happens during a heart attack, because I think if more people understood the reality of it, they'd be more motivated to prevent it. Your coronary arteries supply oxygen-rich blood to your heart muscle. When one of those arteries gets blocked by plaque, the muscle it supplies stops getting oxygen. And without oxygen, that muscle starts dying within minutes, not hours, minutes. If blood flow isn't restored within 20 minutes, the damage becomes permanent. The dead muscle is replaced with scar tissue that can't contract. Your heart becomes weaker, permanently weaker. If you lose 10% of your heart muscle, you might not notice much difference. If you lose 20%, you'll get winded climbing stairs. If you lose 30%, walking to the mailbox becomes a challenge. If you lose 40% or more, you're looking at heart failure, constant fatigue, swelling in your legs, fluid in your lungs, progressive disability until you die. That's if you survive the initial attack. 30% of people having their first heart attack die before they reach the hospital. Just dead, no second chances. And even if you survive and we save most of your heart muscle with emergency treatment, you're not the same person anymore. You're a cardiac patient now, for life. Multiple medications, regular monitoring, constant worry about the next attack. Because once you've had one heart attack, your risk of having another is exponentially higher. Is that really how you want to spend your last 20 or 30 years? Managing a completely preventable disease that you gave yourself through lifestyle choices? Let me tell you about a patient I saw 40 years ago who did everything right. His name was Thomas. Came to see me when he was 45 years old. No symptoms, no complaints. Just wanted a checkup because his father had died of a heart attack at 50. I did a full workup. His cholesterol was 240. Blood pressure was 140/90. He was 30 pounds overweight, didn't exercise, high-stress job, all the classic risk factors. I sat him down and I told him what I'm telling you now. You're headed for a heart attack, probably within the next 10 years, but you can prevent it if you make changes now. And Thomas did something most people don't do. He listened. He quit his high-stress corporate job and took a lower-paying position with better hours. He started walking every morning. He changed his diet completely. He lost 40 pounds. Within a year, his cholesterol was 170 and his blood pressure was 120/75. I saw Thomas for regular checkups for the next 40 years. He's 85 years old now, never had a heart attack, never had a stroke, never needed bypass surgery or stents. His arteries are clean, his heart is strong, he's playing with his great-grandchildren and planning a trip to Europe next year. That's what prevention looks like. That's what happens when you take control of your risk factors before they destroy your heart. Now let me tell you about his brother Michael. Same genetics, same family history. Michael came to see me 5 years after Thomas. Same risk factors, same warnings, but Michael didn't listen. He was too busy, too stressed. He'd deal with it later. Michael had a massive heart attack at 53. We did emergency bypass surgery. He survived but lost 40% of his heart muscle. Spent the rest of his life on 8 medications. Could barely walk across a room without getting winded. Died at 68 from heart failure. Same genetics, same starting point, different choices, different outcomes. That's what I want you to understand. Your genetics load the gun, but your lifestyle pulls the trigger. You have control over this, more control than you think. So here's what I want you to do right now, today, not tomorrow, not next week, today. First, schedule an appointment with your doctor. Get a complete physical, blood pressure, cholesterol panel, including LDL, HDL, and triglycerides, fasting blood sugar, and A1C. Get all the numbers because you can't fix what you don't measure. Second, if you smoke, make a plan to quit. Today, not next month, join a support group. Get nicotine replacement therapy. Talk to your doctor about medications that can help. Do whatever it takes, but stop putting poison in your body. Third, if your blood pressure is elevated, get it under control. Immediately, cut sodium, lose weight, exercise, take medication if you need it, but get that number below 120/80 and keep it there. Fourth, if your cholesterol is high, fix it. Diet, exercise, medication, get your LDL below 70 and your HDL above 60. Don't wait for your doctor to tell you it's urgent. It's already urgent. Fifth, if you're overweight, start losing it. Not with crash diets, with sustainable lifestyle changes. Cut portions, eliminate processed food, move more, lose 1 to 2 pounds per week until you're at a healthy weight. Sixth, start exercising today, not next week when you're less busy. Today, walk for 30 minutes, that's it. Just walk. Do it every day for the rest of your life. Seventh, change your diet. More vegetables, more fruit, more whole grains, less meat, less processed food, less sugar, less sodium. It's not complicated. Eat real food, not too much, mostly plants. Eighth, if you drink heavily, cut back or stop. Your heart can't take it, neither can your liver, neither can your brain. Ninth, find ways to manage your stress. Exercise helps. So does meditation. So does therapy. So does spending time with people you love. Figure out what works for you and do it regularly. I'm 96 years old. I've been a cardiologist for 72 years. I've seen over 14,000 heart attacks, and I'm telling you with absolute certainty that most of them didn't have to happen. The patients who did the work, who made the changes, who took control of their risk factors, they're still alive, they're healthy, they're active, they're enjoying their grandchildren and their retirement and their lives. The patients who ignored the warnings, who kept smoking, who didn't exercise, who ate poorly, who let their blood pressure and cholesterol run wild, most of them are dead. The ones who survived are disabled, weak, on multiple medications, waiting for the next attack. You get to choose which group you're in. But you have to choose now, because heart disease builds up over decades. The choices you make today determine whether you have a heart attack in 10 years or 20 years or never. I can't make you change. I can't force you to take this seriously. All I can do is tell you the truth. And the truth is this: your heart is trying to kill you. It's been trying for years, building up plaque, narrowing your arteries, getting ready for the day when blood flow stops completely and your muscle dies. But you can stop it. You have that power. You can reverse the damage that's already been done and prevent the damage that hasn't happened yet. But only if you start today. I'm 96 years old. I don't know how much longer I have. But I wanted to make this video because I'm tired of watching people die from preventable disease. I'm tired of doing emergency procedures on patients who ignored every warning sign. I'm tired of telling families that their loved one is gone when it never had to happen. If you take nothing else from this video, take this. Heart disease is not inevitable. Heart attacks are not bad luck. They're the predictable result of years of poor choices. And you can make different choices starting right now. Call your doctor, schedule the appointment, get the tests, get the numbers, and then do whatever it takes to fix them. Your heart is the most important muscle in your body. It's been beating for you every second of every day since before you were born. Don't you think it deserves better than cigarettes and fast food and chronic stress? Take care of it. It's the only one you've got. The clock is ticking. What are you going to do?